So from acupuncture to acupressure, enhancing supportive care and patient autonomy in oncology. So I am Diane van der Vliet, acupuncturist and auriculotherapist with a background in clinical research. So you have the picture where I am currently in Beaujolais, so in the vineyards in France. So I'm practicing in a clinic at Lyon. I have a specific tribute to my professor who inspired me so much, Dr. Nadia Wolf. I had my diploma in acupuncture in 2015. And in addition to acupuncture, we were trained in auriculotherapy with a specific method to determine with observation in the ear the root cause of any disease. So it was quite amazing for a physician. During this training, we had a specific class on integrative oncology and what is the place of acupuncture and auriculotherapy in oncology supportive care. And during my training, I had my first clinical case. So it was Maria. She was a woman, 45 years old, with an advanced ovarian cancer. So with acupuncture protocols I learned, I have been able to really make her more comfortable. She had no severe side effects with chemotherapy. She can have the full treatment with the full dosage. And especially, she had no side effects, no neuropathy with cisplatin. And really, for me, it was, I really realized the benefit of acupuncture for supportive care for cancer patients. And I wanted to know more about integrative oncology and wanted to understand more what it is. So the next slide is a definition of integrative oncology. So in integrative oncology, you have, in addition to conventional medicine, so the standard of care, you have lifestyle modification, but you have as well complementary practices. So these complementary practices, complementary medicine, are evidence-based and used alongside standard of care treatments. As part of them, you have acupuncture and, of course, yoga. So my talk is more on the acupuncture. The benefits of integrative oncology, you have many benefits. Not only relieving pain, reducing anxiety, reducing depression, improving fatigue, but you have also improving quality of life, improving survival. We have many publications to make that evidence now. In France specifically, so you have a French-speaking association for supportive care, cancer care, and they have published results of a barometer in 2024. And the key finding is that nearly 70% of cancer patients have access to complementary practices. So this is really important for patients. But as well, this barometer shows that the information, 30% patients report being somewhat or very dissatisfied in this regard because they have low information of what are integrative therapies, how to find qualified professionals. There is this patient ebook. This is really informative. This has been published by the Society of Integrative Oncology. So this book has been made by cancer survivors, patient advocates, and medical professionals as well. This is really well done, and you have a summary of the guidelines. So the guidelines published by ACO in collaboration with ESCO, so the American Society of Clinical Oncology. So really, so I move forward. So there is a table in this ebook showing the integrative choices to support symptom management for cancer patients. So especially, so you have, my talk is about acupuncture and acupressure. And you can see that for acupressure, so the ESCO and SIO, as based on their recommendation, acupuncture may be offered for pain management, anxiety, and acupressure may be offered for pain management. So what is acupressure? So acupressure is like reflexology. This is a touch therapy that aims to provide the same benefits as acupuncture. Acupressure uses energy lines called meridians that cover the entire body and include 800 pressure points. Acupuncture is a common treatment in many cultures and includes placing very thin needles into specific points of the body. Acupuncture has been shown to reduce pain, nausea and vomiting, impaired sleep, anxiety, and depression in cancer patients. So here, this is an example of the benefit of acupuncture in managing the chemotherapy-induced peripheral neuropathies. So CIPN are dose-dependent and constitute the second most frequent adverse effect of chemotherapy, affecting more than 60% of patients. So the highest risk chemotherapy classes are platinum agents, Texans, and vincristine. CIPN most often appear during treatment and can persist in the longer term, becoming chronic. They can be debilitating in daily life due to sensory disturbances in the feet, making it difficult to walk, drive, or sleep. Difficulties with grasping objects, leading to dropping them. So according to SIO and ESCO guidelines, so acupuncture may be offered to manage chemotherapy-induced peripheral neuropathy. This recommendation is based on publications. One of them is here. So this is a randomized clinical trial conducted in the Memorial Sloan Kettering Center, Cancer Center in the US. It is really a well-known cancer center. And this is a phase 2 with 75 patients with persistent moderate to severe CIPN under 3 or more months of chemotherapy. So the interventions comprise 8 weeks of real acupuncture versus sham acupuncture or usual care to treat CIPN. So for real acupuncture, this consists of 22 points. So you have points in the ear, you have points on the body, and you have also acupoints stimulated with electrostimulation. Sham acupuncture is not acupoints. This is just to put needles outside real acupoints. So this is like a placebo. And the usual care is just observation of patients. So during the 8 weeks, so the patients have twice a week sessions for 2 weeks and once acupuncture sessions a week for 6 weeks. So the main results is that acupuncture, so real acupuncture, was associated with significant reduction in CIP and pain at week 8, whereas sham acupuncture and usual care were not. So you see that there is a reduction of 1.75 points in the numerical rate scale of severity. So now I would like to talk about cancer-related fatigue. This is one of the most common toxicity accompanying the diagnosis and treatment of cancer. Its impacts can be felt across all stages of cancer progression, spanning from the initial diagnosis through the phases of long-term survivorship. So 30 to 60% of patients experience moderate to severe fatigue during the courses of the treatment. 20% to 30% of individuals continue to experience fatigue for months or years after treatment's completion. The definition is persistent and often overwhelming senses of physical, mental, or emotional exhaustion, and it does not really subside with rest or sleep. According to the SIO-ASCO guidelines, so for acupressure, there is a recommendation for cancer survival. So cancer patients, after they have completed their treatment, because this is a period where the patients have still significant fatigue. So I would like to present you a first study that has been conducted in Hong Kong. This is a pilot study, pilot randomized controlled trial, and the objective was to demonstrate the feasibility of self-administered acupressure for Chinese advanced cancer patients. So in this study, there have been 30 advanced cancer patients with moderate severe fatigue. So the intervention was 4 weeks patient center self-administered acupressure interventions or health education. The results show that more than 90% practicing acupressure daily. So the compliance has been very good. The improvement has been observed from baseline for fatigue and other symptoms. The following slide is showing in more detail what the SIO and ASCO recommends in terms of acupressure. So they recommend acupressure sessions once daily for 6 weeks with specific acupoints. So you have Yin Tang, Amyan, Earth 7, Spleen 6, and Laver 3. And this recommendation is based on the large trial, phase 3 trial, randomized clinical trial, which included 270 survivors of stages 0 to 3 breast cancer receiving relaxing or stimulating acupressure or usual care. So those patients were enrolled when they have been completed their treatment prior enrollment. The intervention was 6 weeks of daily self-administered relaxing acupressure, stimulating acupressure or usual care. So depending if you have relaxing acupressure or stimulating acupressure. These are not the same acupoints that patients have to stimulate. On the conclusion, both acupressure arms significantly reduce persistent fatigue compared with usual care at 6 weeks, but as well during a following 4 weeks washout period. It has been observed that the relaxing acupressure has a more significant improvement in terms of fatigue. In this graph, it shows that so you have the brief fatigue inventory score. At baseline, at the enrollment, patients were at a level above 4. So at 4 or below, this is considered as normal fatigue. So all the patients at enrollment have significant level of fatigue. At 6 weeks, at the end of the intervention, more than 60% of patients improve their level of fatigue and they have normal fatigue. And this benefit is still observed 4 weeks after a washout period. Based on those results, an application has been developed at the University of Michigan. So this application is available on the Google Play and so on. So this is available for patients. This is really well done. You have the map with all the acupoints, an explanation on how to locate those points with figures, but also you have video where it's really clear how to locate the acupoints. You have, for the patients, you have the possibility also to track the scoring of their symptoms over time, and also to evaluate with graph how those symptoms evolved with acupressure. There is also the possibility to have notifications, so that helps patients to have on a daily basis a recall to do the acupressure sessions. So it is really, really helpful for patients. So to conclude, so from evidence to experience, acupuncture and acupressure are evidence-based complementary practices alongside standard of care cancer treatment. From touch to empowerment, acupressure turns care into self-care, empowering patients every day. From integration to transformation, integrative oncology not only aims to optimize health, quality of life, and clinical outcomes, but empower people as well to become active participants for their health. So thank you